Here we're going to discuss what a hip replacement is, as well as the approaches for hip replacement surgery. What a hip replacement is when we go in and exchange your arthritic hip for a new metal and plastic components. You'll see on our model here, we have a stem that we place into the femoral canal. On the stem, we have a new ball that goes onto the femoral component. During surgery, we size these to your exact specifications. So essentially, we are building the hip to you. On the socket side, we place a metal socket into your old socket, as well as a plastic liner that goes inside of that metal socket. What is most important during hip replacement surgery is the positioning of our components. We use both the same components, whether we are doing what you may have heard of an anterior approach or a posterior approach to surgery. When we do a posterior approach to the hip, we go make an incision along the side part of the hip in order to expose our hip joint and perform the procedure. When we do an anterior hip replacement, our incision is placed more anteriorly on the hip from roughly here to just over here. Both types of incisions yield great results. If you have two patients that are standing next to one another, one who had an anterior, one who had a posterior, they're both going to tell you that they had an excellent outcome following their hip replacement surgery. Determining where we decide where to do our incision, whether anterior or posterior, will be up to a number of factors which we can discuss at your office appointment. Again, if you have any concerns, please don't hesitate to call.